thinking about evolutionary biology as we think about how the autonomic or unconscious nervous system developed across evolution, beginning with vertebrates. We see that if you look at the earliest vertebrates, of course, lizards, for example, when they experienced a sense of threat, a sense of danger, they had only one possible response, and that was to immobilize, to blend in, to try and be as small as they could possibly be, and hope, just hope, that the predator would go away. And that response is based in a very primitive portion of the unconscious nervous system called the parasympathetic dorsal vagal, which for purposes today, we will just say is located deep inside the primitive brain. As we came up the evolutionary ladder, for example, and fish developed, then the sympathetic nervous system, which is the fight or flight nervous system, came online. And then when threat was experienced, there was the option of trying to get away. And I actually choose this picture quite deliberately because most everybody who's a parent at least has seen the Disney movie Finding Nemo, right? The clownfish Finding Nemo. What did Nemo do when he realized that his father was gone? He started swimming frantically looking for him. And that is sympathetic activation. But it is only in mammals that the capacity to use social engagement in the presence of threat, no matter how small or large a threat, comes online. And that's based in another part of the brain that is deep in the brain, but moving farther forward in the brain, called the parasympathetic ventral vagal system. And that is the part of the vagus nerve that is responsible for our abilities to be calm and interactive. And from an evolutionary standpoint, it is only when the social engagement system is overwhelmed that we go down the evolutionary ladder in a hierarchical kind of way to either sympathetic activation or parasympathetic dorsal vagal response. So for those of you who are clinicians, for example, and want to think about what the clinical correlate of this is dissociation. This is the client who sits in your office, cannot even look at you. This is the client who basically gets angry. And this is the client who has the capacity to engage with you and allow that engagement to represent a form of security that then, of course, is manifested in the ability to work collaboratively to address whatever it is. As I mentioned before, this autonomic nervous system is buried very deep inside the brain in what's called the limbic system. And in the limbic system, there are a number of components that are part of this part of the autonomic nervous system. So the autonomic nervous system, the unconscious nervous system, is responsible for your vital functions, your heart beating, your breathing, for example. You don't have to think to breathe, and you don't have to think for your heart rate to keep going. And there are several components of it. The amygdala is the component that essentially senses the alarm. The hippocampus is the part that remembers and recalls, stores memory, and these memories can be both autonomic, in other words, unconscious memories, the sort of which I would imagine are a part of kind of the fetal phenomena that Professor Wade spoke about. There's also the hypothalamus, which secretes hormone precursors, in other words, the things that are involved in what we call the hypothalamic pituitary adrenal axis, which, bottom line, makes stress hormones, makes adrenaline, and makes cortisol. And then up here is the part that we are constantly waiting for our adolescents to develop. It's called the prefrontal cortex. And as I believe Professor Narvez pointed out, it takes till you're about 30 years old to really become an adult. Why is that? Longer with men. It's because your prefrontal cortex has not come online. So you don't have a good sense of what's really a risk. For example, what the consequences of that potentially will be. Up here, of course, are all your cortical functions, the thinking part of your brain. There's the motor part of your brain. And then the sensory parts of your brain are in around there. But the thing to keep in mind about all of this, which is so important when one thinks about polyvagal theory, is that when we talk about people using polyvagal theory as a developmental kind of phenomenon, it is not a form of therapy. Please do not walk out of here and say, polyvagal theory is a therapy. It is not. Polyvagal theory is a way of thinking about what causes us to feel and behave the way we do. So if, for example, you are either a parent or a therapist, and if you are polyvagal informed, as I try to be most of the time, then what happens is that rather than thinking about, for example, someone as bad, you think again about what caused them to do this, what happened to them that they felt and behaved in the particular way that they did. So before we go on, we've got to talk a bit about nervous system organization, because it's all about the brain. It's as simple as that. There's the anatomy of the brain that we've already touched on, and then there is the autonomic nervous system, which is the unconscious parts of the brain, and then there is the somatic system, which includes, for example, our motor activities. So the unconscious part of our brain, the autonomic nervous system, is a part of the peripheral nervous system, and it includes basically this autonomic component that we talked about, either the sympathetic or parasympathetic components. The central part of the brain, it's really simple. It's just the brain and the spinal cord. That's all there is. But within the brain, and for motor responses within the spinal cord as well, are part of the template that we need to have laid down to be able to feel, behave, have voluntary motor responses. So when we think about the sympathetic versus the parasympathetic component, the sympathetic component is what you are going to need, not just for fight or flight, but actually to continue your daily activities as well. Because if you were purely in the parasympathetic mode, you wouldn't do anything. So there needs to be a bit of what I will call tension in the system, or sympathetic component, to be able to go about our daily lives, or we would just sit there like blobs. So when we talk about all of this, and we talk about sympathetic versus parasympathetic, and, ventral vagal versus dorsal vagal, we don't assign value to these components. Sometimes you really need to be sympathetically activated. When your 2-year-old is running toward the street and you grab and pull him back, it is the sympathetic nervous system that allows you to assess that risk and get your kid out of danger. Likewise, there are times even when a mobilization can be a rational, although we don't think in terms of rational where this is concerned, but in talking to people who are trying to rethink their responses in certain situations, can be helpful. If somebody has a knife to your throat and says, "Your money or your life, you're going to freeze in all likelihood. And you're going to freeze because freezing is the protection against whoever it would be getting so angry, so vicious, so sympathetically activated that they may really, really harm you. When I was in medical school, prior to the development of the polyvagal theory, people used to teach about the sympathetic versus parasympathetic components. But what we all need to realize at this point is that we are really on a spectrum here at all times, if we're healthy, between degrees of sympathetic tone and parasympathetic tone, and people who have disruptions in either parasympathetic tone or sympathetic tone often have very significant health-related issues. Well, how does this all involve the vagus nerve? There are 12 cranial nerves. They sit at the bottom of the very most primitive part of the brainstem, the medulla oblongata, and the pons. And from there, and here is the vagus nerve, it's the 10th cranial nerve, they send branches throughout the body, collecting information at all times. Right now, when I am speaking to you, your vagus nerve is sending you information. 80% of the fibers of the vagus nerve are actually sensory. Only 20% of them are motor. And so the vagus nerve, which is the longest nerve in the body, from stem to stern, has branches that go out. And those branches bring sensory information, affective information, back to the limbic system, back to the central nervous system, that give you the sense of your neuroception. Your neuroception being your unconscious awareness of whether you are safe, in danger, or in life threat. Now, depending upon the experience of people in this room, even listening to my voice, you could have very different neuroceptions. Very, very different. All in the same environment, all listening to the same talk, but as a product of your prior experience, if I happen to look and have a voice that sounds like someone who harmed you, you could be having a neuroception of danger, even right now. And one of the most important functions of the vagus nerve, there's two really, really important functions. One is the effect on the heart. The vagus nerve is what regulates the heart so that your heart does not beat at about 300 times a minute. Because if you looked at the top two chambers of your heart, they would beat at 300 times a minute without the vagus nerve. When you need energy, for example, the vagal tone lifts a little bit. Dr. Porges calls it the vagal brake. So the vagal brake lifts a little to give you a little more energy so you can do things. Even something as simple as eating, you need to have metabolic energy. The other thing that's really important about the vagus nerve is that the vagus nerve connects to what are called facial nerve special efferents. And those facial nerve special efferents control the muscles in your face. So as you can imagine, depending upon the neuroception you have and what is being transmitted to the vagus nerve, you are either going to smile, you're going to scowl, you could look empty, you could look all sorts of different ways, and that connection functions through the vagus nerve. And that connection is so important because when you think about babies and adult caregivers, depending upon what the tone of the adult caregiver is that adult caregiver feeling safe and regulated, feeling angry and in danger, or literally in a life threat situation, in a very dangerous kind of society. Or, for example, one of the things that I think about is the severely depressed mother with a flat affect. That looks like a blank stare. So under Dr. Porges' theory, we talk about the fact that all behavior is in the service of survival. And depending upon what your neuroception is of a particular environment, you are going to have a neuroception that either can be safe and calm, danger, or life threat. But there are multiple components to that environmental sense. One is what's going on inside my body, right? So even listening to me talk, something is going on inside your bodies that is providing information to you about the safety of your environment. Then what's going on outside your body? You know, is somebody using a jackhammer in the next room? And I think this is the one that we really can't emphasize enough. What is going on between our bodies? How is my neuroception affecting your neuroception? And likewise, how is your neuroception affecting mine? And one of the things that's critical to understand is depending upon minute-by-minute changes in the environment, we can go from safety to danger to life threat. We can go from life threat to danger to safety. That's a really hard one. That's a really, really hard one. So neuroception, as others have pointed out, is the unconscious awareness of safety, danger, or life threat.